Trying to conceive naturally? Then try these 7 tips. There are a number of ways a woman can increase her chances and make it more likely that she will conceive a child. In today's video we will be going through tips to put into action to increase chances of getting pregnant naturally and faster. To optimize women's fertility, taking better care of their bodies is a good first step. The most important advice for a woman who wants to get pregnant is to get to know her body, specifically her menstrual cycle. Here are 7 tips that may help increase a healthy woman's chances of becoming pregnant. Tip number 1. Monitor ovulation. It's harder to predict ovulation in women with irregular cycles, but it usually occurs 12 to 16 days before the start of her next period. However, there are several methods women can use to help determine their most fertile days each month. Home ovulation prediction kits can take some of the guesswork out of figuring out when a woman is ovulating. Tip number 2. Record period cycle frequency. A woman who wants to have a baby should monitor whether the first days of her period tend to come the same number of days apart every month, which is considered regular. Conversely, her periods may be irregular, meaning her cycle lengths vary from month to month. By tracking this information on a calendar, a woman can better predict when she might be ovulating, which is the time when her ovaries will release an egg every month. Tip number 3. Make love every other day during the fertile window. The fertile window spans a 6-day interval. These are the 5 days prior to ovulation and the day of it. These are the days each month when a woman is most fertile. Some women are turning to new technology tools, such as fertility tracking apps and websites, to help them keep tabs on when they may be more likely to conceive. Tip number 4. Strive for a healthy body weight. Being too heavy can reduce a woman's odds of conceiving, but being too thin can make it even harder to have a baby. Research has shown that a woman who is overweight can take twice as long to become pregnant than a woman whose BMI is considered normal, and a woman who is underweight might take 4 times as long to conceive. Having too much body fat produces excess estrogen, which can interfere with ovulation. Losing about 5 to 10% of body weight before a woman starts trying to get pregnant could somehow improve her fertility. Women who are too thin might not be getting regular periods or could stop ovulating. Tip number 5. Eat healthy foods. Although there may not be a specific fertility-promoting diet, eating a variety of healthy foods can help prepare a woman's body for pregnancy by giving her adequate stores of critical nutrients such as calcium, protein and iron. This means eating a variety of fruits and vegetables, lean protein, whole grains, dairy and healthy sources of fat. Besides taking a supplement containing folic acid, a woman can also obtain this B vitamin from foods such as dark green leafy vegetables, broccoli, fortified breads and cereals, beans, citrus fruits and orange juice. When trying to get pregnant, eat lower amounts of high mercury fish, such as swordfish, shark, king mackerel, and tilefish. Also, go easy on caffeine. Consuming more than 500 milligrams of caffeine a day has been linked with a decrease in fertility in women. Tip number 6. Cut back on strenuous workouts. Being physically active most days of the week can help a woman's body prepare for the demands of pregnancy and labor. But getting too much exercise or doing frequent strenuous workouts could interfere with ovulation. Doctors see a lot of fertility disturbances in women who exercise heavily, and a lot of times these women need to cut back on their workouts if they want to become pregnant. Tip number 7. Kick the smoking and drinking habits. Smoking can lead to fertility problems in both women and men. Chemicals found in cigarette smoke, such as nicotine and carbon monoxide, speed up the loss rate of a woman's eggs. Smoking ages a woman's ovaries and depletes her supply of eggs prematurely, according to the Mayo Clinic. It's also a good idea for women to stay away from secondhand smoke, which may affect their chances of becoming pregnant. Marijuana and other recreational drug use should also be avoided while trying to conceive. It's safest for a woman to avoid alcohol when she is hoping to become pregnant. A woman should also stop consuming alcohol if she stops using birth control because she wants to get pregnant. Once a woman becomes pregnant, there's usually no safe amount of alcohol. If you're trying to conceive and are looking for natural ways to boost fertility, you should try to lead a healthy life based on a balanced diet, moderate exercise, and avoiding stress. Consulting a fertility specialist can help you come up with a good long-term plan for boosting your fertility and conception. Don't forget to like this video, subscribe to this channel and check the recommended videos coming up on the screen now.